So I hear you ask, what is the nursing responsibility for vaccines? This is discussed in the book in page 285. It's very important that proper storage is maintained. Read the instructions. There will be a facility protocol before and after vaccine administration. Usually you have to check expiration dates, administer the vaccine as directed, and then document with lot number and expiration date. You want to be able to do patient and family teaching, especially if you're working with children. You want to be able to reassure the parents. Be familiar with the product package insert arguments for the dangers of vaccines. That's one of the big things. Anti-vaxxers discovered that mercury was not an issue because it's not even found in any vaccines other than the vial or the large vial of flu vaccine. It's not been found in any other vaccines that you give to children. Then they worried about aluminum, but aluminum's present in, the air we breathe and the water we drink and the soil. And then they were worried about, they'd tell you antifreeze and other things are in vaccines, which they're not. But they have a big fear of all the stuff that they talk about in the insert for vaccine ingredients. Now, these folks won't listen to the CDC or WHO, the World Health Organization, but when they look at the product package inserts that the CDC is responsible for developing, they treat them like holy gospel. And they don't really think about the fact that the product package insert in vaccines is a legal document. It's not a medical document. But, it doesn't hurt to, when they say, have you read the vaccine inserts? You can say, yeah, I have. Nothing there to worry about. But be familiar with the common arguments. Educate yourself. Page 285, we talk about antibody titers. Like I said, you can draw your blood and look at the level of immunity you have against these various illnesses, and that can sometimes determine if you need to be vaccinated again or not. On page 286, there are lifespan considerations and patient and family teaching. Any patient who is immune compromised should always check with their healthcare provider before somebody in the household gets live vaccines, just to be on the safe side. It might be fine, but you want to make sure. All right, so that's what we have to say when we're talking about vaccines. Let's talk about medications given to immunomodulate. These are drugs given for to prevent rejection of an organ, and in the case of certain illnesses where the immune system is too strong, where you have autoimmune situations. So we have three categories of drugs that we're going to refer to, and I'm sorry that this camera is bouncing all over the place. Like I said, while you listen to this lecture, please just be looking at your own copy of the slides so you don't get like a migraine headache from all my bouncing. We're going to look at anti-rejection drugs, which suppresses certain features in the immune system that would reject a transplanted organ. Anti-proliferative drugs that slow lymphocytes that are many times responsible for autoimmune diseases. And then calcineurin inhibitors that also are used as treatment for autoimmune illnesses and to prevent transplant rejection. When it comes to these medications, the expected side effects, the action is to reduce immunity so your body does not attack itself or attack organs that you might have gotten transplanted. However, the big adverse effect is that you can increase infection risk and over a lifetime the risk for cancer development. It's believed that we many times begin to grow abnormal cells that could lead to cancer, but because our immune systems are strong, we fight them off. But in the event where we are suppressing the immune system, many times that increases your cancer risk over a lifetime. It's important for drug interactions to know that transplant patients are going to have to take their anti-transplant drugs for a whole lifetime. So they need to look at what medications they're presently taking and how they would interact with a medication to prevent rejection of the organ. So certain drugs that are listed, cyclosporin, a very, very common immune suppressing drug, everolimus and tacrolimus, sirolimus, they all will increase your cholesterol. So people are going to have to be told to try to eat a low carb, high vegetable and fruit diet if possible, and to watch their cholesterol very closely. For cyclosporin and sirolimus, they have to be mixed in a glass container, not plastic, because they'll stick to the plastic. They have to be mixed with either milk or juice. Water will inactivate it. And they need to rinse the container to get all traces of the medication out with the same solution that it was mixed with to begin. So you mix it with juice, and then you're going to rinse the container with juice before it's washed to make sure that all that medication is not clinging to the sides. When it comes to these medications, these immune suppressants, you want to watch for signs and symptoms of infection with those medications. Sometimes the person needs to monitor their temperature daily. Look for other signs and symptoms of infection: sore throat, body aches, malaise. These drugs are very strong drugs, and they can be very liver toxic. So somebody taking any of these medications wants to avoid drinking alcohol and using Tylenol regularly. You want to warn somebody about the signs and symptoms of liver damage: nausea, vomiting, abdominal pain, dark urine, pale stools, all the things that can indicate liver damage, and ultimately jaundice. Anti-proliferative drugs, which are discussed on page 288 of the book, are associated with negative pregnancy outcomes. Many of these drugs are category X. So 2 methods of contraception need to be used to make sure that the mom doesn't become pregnant while on these medications. If the medications are discontinued, she should wait at least 12 weeks. So wait 3 months after these drugs are DC'd before attempting pregnancy. And look at page 290 for lifespan considerations for these medications. I guess that's it for our slides. So make sure for these various medications that you look at the table on page 288, and it talks about anti-proliferative drugs and calcineurin drugs that can be given for a variety of autoimmune issues and for transplant rejection.